With you. I'm going to give everyone a minute or so to join in on our amazing presentation. This is going to kind of gross you guys out, but it's very, I'm very excited to spend this time with you. Today, we are going to be talking about tapeworm infection, symptoms, and treatment. So, not just tapeworms, but how they infect us, different nutritional deficiencies we could have, different test results we could have, how we become infected with tapeworms, and the best ways to treat them. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. And I was diagnosed with multiple sclerosis 35 years ago. And by the grace of God, I learned early on that the disease I was dealing with was caused by parasites. And so, with a lot of diligence and work over the years, and a lot of research and trial and error, and working with hundreds and hundreds now students from all over the world, we're really starting to hone in on the types of parasites that are making us sick. So, for example, with not just multiple sclerosis, but all kinds of other diseases, we're really starting to see over the last couple of years that yes, we do have small parasites, but we definitely have a lot of larger parasites. And I think that tapeworms are a lot more common than we were ever told that we would possible. Well, number one, we're told we don't have parasites in developed countries, but a lot of us never thought we could have a tapeworm, but it's more common than you think. So today we're going to go over all of this. And for me, it was a really big aha moment because I'm going to share with you like some of the different reasons why I believe that I was dealing with tapeworms, not just tapeworms, but tapeworms also. So, what are tapeworms? Tapeworms are flat worms. They are segmented, so they have little partitions. And there's many different types of tapeworms, but there are at least 6 different types that can cause disease in humans. So there's 3 different parts to their life cycle also. And the first part is the egg, or we call it an oncosphere in biology. And there's also an immature form, which is the larva, and there's the adult form. And so those 3 forms are part of how these tapeworms infect us. So the way that they describe different types of tapeworms is really by the different animals that they infect. So there are beef tapeworms, there are pork tapeworms, fish tapeworms, and then there are tapeworms that infect our pets, like our cats and our dogs. And tapeworms take approximately 5 to 12 weeks to go from the larva, the immature form, to develop into an adult inside of the body. And some of these species can live 25 years in our body. So one way that we can become infected with tapeworm larvae is that if we're eating meat that is not cooked, because the immature form will move into muscle of the animal. And then if we don't cook it well enough, then we can end up eating that immature form and then becoming infected with tapeworms. We're going to talk, there's a lot of different ways that we can become infected with tapeworms. And I don't want you to be fearful because it's just a part of life. We are exposed to parasites in our environment all the time. But when we actually appreciate that that is the case, and then we can use some different measures to reduce our risk, and then just pay attention to if we ever have symptoms, then what we can do is we can just really avoid ending up with chronic disease like multiple sclerosis, but not just MS, but other diseases. So the tapeworm eggs are passed through bowel movements from the animals. So what happens is the tapeworms, they can grow, depending on the species, they can grow up to 25 feet long. And little chunks, those little segments, they're going to break off, and they carry a lot of eggs. And so they will travel out through the stool or the feces, and they will infect whatever. Like if we have tapeworms and if we go to the bathroom and we don't wash our hands well enough, we can self-infect ourselves. If somebody's preparing our food for us at a restaurant and they had a bowel movement and they have tapeworms and they did not wash their hands well, they could infect our food. We can get it from our pets. So, and we can get it from eating meat that's not cooked well. So, we'll talk about how to prevent that later on. And then what's really interesting is that adults definitely have symptoms, but children have stronger symptoms of tapeworms. And with respect to the life cycle of the tapeworm, so either animals or humans, they will ingest the tapeworm eggs and they will make their way down to the intestines and they will hatch there and they will turn into they will get into the intestines, hatch, and then they move out of the intestinal lining and they will move into various parts of the body. So some tapeworms will live in our intestines, but a lot of the immature form, they can move out of the intestines and they can infect different parts of the body. So, how do we become infected with tapeworms? We may eat food that is contaminated with eggs of tapeworms. Also, water, if the water isn't treated well. I spoke last week about the municipally treated water should be treated well, but sometimes the systems don't work. So we could drink raw water at times. And if you live in an area where the water is not consistently treated, make sure to boil your water for sure. So contaminated food, contaminated water, eating undercooked fish or meat, and self-infection and human to human contact and from our pets. And the symptoms of tapeworms, you'll be quite shocked because if you have neurological symptoms, a lot of these are things that we have had. So, before I share the symptoms, the severity of the symptoms really depends on how many tapeworms we have. So, I've heard one practitioner say, "Oh, you can't have more than one tapeworm in you because you wouldn't be alive." Well, apparently that's not the case. You can have multiple tapeworms inside of you. And it's not just the tapeworms in the intestines that's causing these symptoms, but what's even worse is that when the immature larvae form, they make their way into different tissues like our liver, our eyes, our central nervous system, and other places. They cause significant problems, significant disease. So if we just look at general symptoms of tapeworms, fatigue is very common, and weakness or loss of strength, loss of appetite, nausea, vomiting, and that's quite common in children that have tapeworm infections. Stomach pain, especially worse in the morning, and it is resolved with eating a little bit of food. Rectal itching, constipation or diarrhea, gas, weight loss, malnutrition. If you become malnourished, for example, hunger pains and cravings, difficulty sleeping, and irritability or hyperactivity in children. So that is just a tapeworm infection generally in the intestines. That's like the adult form of the worm. But if you have the larva, the immature form that move into different parts of the body, for example, again, the central nervous system, the liver, lungs, heart, and eyes, that is where we start to have significant symptoms. We can have a lot of neurological symptoms like headaches and dizziness, poor balance, poor coordination, difficulty walking and falling often, nerve pain in the spine or the limbs, muscle weakness, muscle twitching or spasms, seizures, changes in our thinking or behaviors, maybe some confusion or loss of consciousness for even a moment. And so these cysts, when they move into the central nervous system, and I've talked about this before, but very often there's these little bladder sacs that will form, and it's called, let me just go back to the name here so I can pronounce it properly. It's neurocysticercosis. And that is basically when the larva, the immature form of the tapeworms, enter into the central nervous system. And usually what happens is that, and this is in animals, this has been shown a lot, but this happens in humans too, is that they form these little cysts, is like a bladder. and there's a whole bunch of developing little immature larva tapeworm inside of them. And when Dr. Alan MacDonald actually found these immature forms of the tapeworm in patients that had died, that had multiple sclerosis, and it's really disgusting. If it's a pig tapeworm, they have these little hooks on their head. And if it's other tapeworms, like the beef and the fish, it's more suction or suckers that they suck on, they hold onto the intestinal lining. That's how they would hold on in the intestines to be able to stay there. So when we have these like immature forms inside of our central nervous system, they show up as little lesions and or cysts or lesions on MRIs, etc. And they have been documented in the central nervous system of MS patients. And they are documented for people that have epilepsy also in the central nervous system of patients that have epilepsy. So we know that they're in there. And actually, Dr. Alan MacDonald also found developing juvenile tapeworms, so immature worms, so not just the larva form, but the actual where it's starting to become segmented inside the central nervous system of MS patients. So that's been documented that it does happen. Absolutely. How often? I don't know. Is it always present with MS? I don't know. And the same thing with epilepsy and probably other diseases. So going back to the symptoms of when we have the larva, the immature form of tapeworms in our central nervous system, which is called neurocysticercosis, that would include headaches, dizziness, poor balance, poor coordination, difficulty walking, falling often or falling, and nerve pain in the spine and limbs, muscle weakness, muscle twitches and spasms, seizures, as in epilepsy. And I talked about the changes in cognitive function. And I have seen one report of a woman in Alberta, Canada, who had this tumor in her liver. And I have no idea how the doctor figured this out, but the tumor was actually just a big collection of, I think it was larvae of the tapeworm. So it's a specific tapeworm that was just like the tumor was just loaded with this larva of the tapeworm, which is crazy. And then also, so you can have a lump if these immature larvae end up in your muscle tissue. You can definitely have a lump or a cyst, for example, and there can be pain and swelling at the site where the larva cyst infection is present. So let's look at the blood work and deficiencies and complications of tapeworm infection. So anemia is very common, and that's due to a deficiency in vitamin B12. So a lot of us think, like, we eat animal protein, we should not be deficient in vitamin B12. But if we're deficient, and then also just know that if you have a vitamin B12 test done, it doesn't necessarily show a vitamin B12 deficiency. So there's homocysteine or MMA tests that would be more accurate to help you to know if you are deficient in vitamin B12. But anemia is very common with tapeworm infections, and low red blood count, low red blood cell count. And then again, this cysticercosis complication, it can lead to seizures and eye damage. So one researcher that I was listening to, he was saying that the immune system will deal with these little larvae often if they're present in our blood, et cetera, and in certain organs. But in the central nervous system and the eyes, the immune system doesn't seem to deal with the immature tapeworm as well. So it can definitely cause a lot of eye damage and gallbladder disease and pancreatitis and appendicitis also, and abdominal obstruction. So all of these things can, and of course the abdominal obstruction is probably more when we have a number of tapeworms present and inflammation. But there is such a wide variety of different things we could be dealing with. Diagnosis. Well, stool tests, I talked about that last week. They're not very accurate. You should have multiple stool tests done. And they're looking for the eggs, and they're also looking for the parasites or even segments of the tapeworm. So at least 3 different parasite stool tests done on different days, and chances are you probably still won't find the parasite. You probably still won't get a positive test result. There's a cellophane tape swab for eggs, and there's PCR tests. There's blood work where they're looking for eosinophilia, where you have a slight increase in a certain type of immune cell, which helps to fight parasites, which is it's eosinophils. And then also on MRIs or CT scans, sorry. So imaging on MRI or CT scans, looking for the larva present in the central nervous system. And treatments. So we'll go into the treatments here. Treatments would include albendazole, and that's especially for when the larvae enter into the central nervous system, the immature form. And praziquantel is more if it's more in your intestines. Niclosamide is another parasite drug. I really don't believe that we can recover with just herbs. I love herbs, but we have not found that the herbs are effective enough on their own. And then also vitamin B12 supplementation if we are deficient in vitamin B12 because of the infection. And then anti-epileptic medication. So if we're having seizures, to use a medication. But obviously we want to treat the parasite so we don't have seizures in the future. And then one study that I looked at, they found that albendazole and praziquantel combined together had a better killing effect for those cysts in the central nervous system where there's like a little sac of the developing tapeworms in the center, because you can imagine that would be harder to treat. If it's like in a cyst form, it's kind of protected and it's in the central nervous system. So albendazole does cross the blood-brain barrier and praziquantel does not really, but apparently the combination of the two seem to be more helpful. And also albendazole is absorbed better with a lot of healthy fat with our meal. That's really important too. But really fascinating. So for myself, I was just, thinking back when I was 12 years old, I had appendicitis. And I was always the kid we had 6 children. I was the oldest, and I was always skinny. I was always underweight. Always had stomach aches. If I ate anything, like if we had hamburgers, which wasn't very often, I would have a stomach ache. If we had Chinese food, I'd be laying on the ground with stomach aches. I'm not saying that tapeworms were the only cause of my symptoms, but there's a lot of symptoms that look like, that I could have had tapeworm. And I'll just and this is where I want you to start thinking about your own life. So we do know, for example, the appendicitis, it's not just tapeworms that can cause appendicitis, but appendicitis, we have inflammation in the appendix, and that's part of our immune system. And tapeworms definitely can be involved. So whether it's roundworms or whether it's tapeworms, when the doctor removed my appendix, he said, your appendix was fine. There was nothing wrong with it. But I had a lot of stomach pain, and he thought this was not back in like the early 90s. No, it would have been way earlier. It would have been when I was just 12 years old. So a lot sooner than that. Then, so again, underweight, stomach aches like crazy. And then later on, once I realized, like I've carried parasites around with me forever, I was able to get the MS under control with the amount of work I did with the parasites, but I still knew that I had parasites. And so learning like from the doctors on how to help my students recover from parasitic infestations. So I decided to do the treatment myself. So just as I've shared with you in other videos, I was energy tested, and I tested really well for albendazole, ivermectin. So ivermectin, there's roundworms, and possibly albendazole too. But albendazole, again, now you've learned that it could also be helpful for tapeworms. But then I really tested very strongly for praziquantel, which is tapeworm and flukes, and then also niclosamide, which is another parasite drug that treats tapeworms. So I tested well for like 3 parasite drugs that will treat either tapeworms in the intestines and or tapeworms, the immature forms in the central nervous system. So when you look at your symptoms and then you look at what you test well for, and then when you start treating and you start passing these worms and you start saying like, oh, wow. So for example, with tapeworms, like when you're looking at the worms that you pass, a roundworm looks just pretty much round. Even if you've done a CD enema and they're pretty consistent, right? Like it's about a couple millimeters wide and it's long. It could be 6 inch, it could be broken in half, 6 inches, 12 inches, 18 inches. But the tapeworms are flatter, and tapeworms don't have a digestive tract. So they're absorbing nutrition from the food in your intestines. So they'll look a little bit different, where it looks a little bit more segmented, especially with it almost looks like, food moving into them kind of thing when you've treated them. So it looks like a little bit like blockier and flatter like a ribbon versus round like a roundworm. So with my observations of what I've passed with what I tested well for, I still do believe I also had intestinal flukes, but it looks more like I had tapeworms too with what I tested well for with all the different parasite drugs. So, and then that connection between worms and also the appendicitis is really fascinating because, again, my appendix was fine. And I was really upset that I had my appendix taken out when it was absolutely fine. All right, so I'm going to see if you guys have any questions. I'll answer your questions here for a minute. And another profound finding, again, was Dr. Alan McDonald finding the immature tapeworms and developing small tapeworms, like the actual adult worm developing in the central nervous system of MS patients. Before I go to your questions, I'm just going to do a little bit of prevention here. How can we prevent tapeworm infections? So, washing your hands a lot. Like, even if you're in the garden, wash your hands when you come in because there could be an animal that had tapeworm and there could be eggs in the soil. So, washing your hands, whether you're doing your pets, whether you're cooking, we always use bleach for bleaching with raw meat, and I still wash my hands and I count till at least 20 because I've heard that at least 20 seconds is important for when you're rubbing soap on your hands. So don't just do a really quick rub and rinse it off, but do like 20 seconds would be really helpful. Washing your fruits and vegetables because they can also be contaminated with these proglottids, which would come from even other countries or even from our own country. Again, parasites are present in all developed countries and the underdeveloped countries too. You cannot avoid parasites. And then improve sanitation. Treat your pets regularly. Treat them for the best is to have them energy tested and to see what they test well for. Otherwise, you're just guessing. I went to a veterinarian once and he's like, oh, let's see what we have in our area for parasites. And he did a Google search. And I'm like, that doesn't mean my dogs have that parasite. So the energy testing, you can have your dog's energy tested too, or your cats or your other your animals, have them all treated, dewormed regularly. If you're in town, make sure to clean up the feces, the stool from your animals. Try to keep your yard, and of course, some of it could rub onto the grass, but I think it helps a lot. And please understand that if you have a dog that goes into the backyard and poops back there, and then he or she steps on the feces and then walks back in, they're going to track it back into your house. And then if you have little children crawling around on the floor, they are going to be ingesting the eggs very, very easily. And I look back on our dogs that we've had in our family. We had a golden retriever, and she had huge, huge tumors at the end of her life. And the same thing with another dog where they just had parasites. And so when the dogs are sick and they're elderly and they're loaded with parasites, you know darn well they're going to be depositing a lot of the eggs into your soil, into your grass. So even to have a dog run, having it separate from where your kids play is a really good idea. Being careful, like if your dog is pooping and peeing outside all the time and you're walking barefoot, like, I don't know, like it's just, all of this education has really opened my eyes to be a little bit more careful. So again, treating your pets regularly, cleaning up their feces, treating them for fleas. Apparently some of these tapeworms, they will go from dog to the flea on the dog and then back to another dog or human, whatever. So treating them for fleas, not just for tapeworms, because the fleas can be an intermediate host. Proper sewage treatment, of course, which most of us are dealing with. And then make sure to cook your meat to, they say, at least 165 degrees Fahrenheit or 74 degrees Celsius. Just make sure you cook your meat well. And I used to like to eat medium cooked beef, like medium, not medium rare, but medium. But I think I'm not going to do that anymore, just with what I've learned. Like, not to kill and the meat so it's so dry you can't eat it, but I think I'm just going to have just cooked to like 165 degrees to be on the safe side, because once you've recovered from parasitic infestations, you just don't want to go back to that again. Also, to flash freeze fish. So, for example, with sushi, that's another huge area where we can be contaminated with not just tapeworm, but other worms. And they say at least for fish, 31 minus 31 to minus 35 degrees Celsius for at least 15 to 24 hours. So if you're eating in a restaurant, if they have not frozen the fish well enough and you're eating raw fish, you are very, very likely, going to make yourself accept or susceptible to picking up different tapeworm and other worms. And then other meats besides fish should be frozen at least 7 to 10 days at minus 31 to minus 35 degrees Celsius. This decreases the presence of the immature larva form of the parasites. Okay, I'm going to go to your questions, just answer a couple of questions here. Hello, Kevin. Hi, Lee. All right. Hello, hello. What is the best way to treat central nervous system parasites? So, David, the best way to treat the parasites that enter in the central nervous system is we always want to engage our immune system, right? So, if we have chronic disease, we're so infested that our immune system is just not able to help us like it should. So, we always do, following the Live Disease Free plan, we always decrease the food to the parasites so they're less active, they're going to be easier to treat. Then we support the body. So we're feeling a lot better before we start treating. And then we get energy tested on the most common parasite drugs, because you may or may not have a tapeworm. You might have roundworms, you might have other worms. I've shared different research, I don't know if you've noticed, but different research where there is filarial worms in the central nervous system of MS patients also, and other people too. So, and I forgot to mention, other symptoms are like itchy rashes, allergic type reactions, and also itchy nose. Those are all symptoms of tapeworm infections and could be from other parasites too, but they specifically said tapeworm infections. So then if you do have parasites in your central nervous system, so for example, if you have filarial roundworms, which are very small roundworms, or if you have tapeworms, that would be more of the the uh, the the immature larva of the tapeworms. Then it would be the albendazole, and you have to take the right amount. And then you also have to have enough fat with your meal so that you're absorbing it, it's absorbed more. It'll work more systemically. Otherwise, it'll just be work. The albendazole will just work in the intestines if it's not absorbed well. And then, as I mentioned, one study showed that they actually looked, and I'll be putting all of this in the blog, they actually looked at increasing the dosage of albendazole, or they looked at, so one group of people that had the larva in the central nervous system, they used albendazole. Another group used an increased dosage of albendazole. And the third group used a blend of, or a combination of albendazole and praziquantel. And that third group had a greater clearing of those cysts. And I do know that in animals, the veterinarians will actually remove the cysts from the brains of the animal. And so the animal will have a lot of neurological symptoms like MS. They'll remove that little bladder, that little sac of the developing tapeworms, and then close up the brain of it was a sheep that I looked at. It was just on YouTube. I'm sure you can find it. And then the animal just could walk around after like normal. So it's pretty crazy. So sometimes it is these immature forms of the tapeworms that cause the neurological, like the paralysis and all of that kind of stuff, and dizziness and not being able to walk, all of that weakness. But sometimes it's just in the gut too. A lot of it is in the gut. So you would want to use something that crosses the blood-brain barrier, and not a lot of them do. For sure, albendazole does. I can't remember if Alinea does also. It might. I'll have to look that up. Are enemas necessary to remove parasites, or uh, will colonics, I think I don't know what you were writing there, but what we use, I can't talk about it here because I'm on Facebook and YouTube and we will get censored. So we use enemas, we use an oxidizing agent which brings in oxygen. And it actually, the oxygen is what kills the parasites. If you would like to learn more about that type of enema, so we don't use coffee enemas because it could possibly stimulate the parasites, even decaffeinated, and we don't want to stimulate the parasites. We're only using enemas that are helping to treat parasites in the large intestine. We can't reach the small intestine with enemas, but we definitely can pass a lot of parasites from the large intestine. And so a lot of the tapeworms are present in the small intestine, and that's why we have to use parasite drugs. But if you want to learn more about that oxidizing agent that helps to treat the parasites in the large intestine, by itself, it's not enough to cure parasites, but we're using it with the parasite drugs and with antimicrobial herbs. So you'll find that on Rumble. And there is using our oxygen therapies to treat parasites. That video there, it's been pretty popular. You can watch that later. Anything about lice and parasites? Yes. Well, fleas, all I know is that there are like the biting insects, they carry parasites and they carry different types of parasites. So it's not just the ticks, mosquitoes, horseflies, fleas, lice, all of them, they carry different types of parasites. Sometimes it's filarial worms. It could carry the Lyme infections. It could possibly carry some of the immature, it does. Like the fleas have been known to carry immature forms of not immature. Is it? Yes, the immature form. No, I was wondering if it was the egg or the immature form, but I'm sure it's the immature form of the tapeworm also. So yes, biting insects definitely carry a variety of different types of parasites, which is crazy. Even mosquitoes. And energy testing, if you don't know what energy testing is, I talked about it last week. I did have to cut my call short or this presentation short last week because I had coyotes right behind me. We have a fence and a forest just a few feet from the back of our house here. And the coyotes were going crazy and they were trying to lure my dogs out. And so I had to leave and they're fine. The dogs are totally fine. But it got cut short. My presentation was cut short on Facebook and YouTube. But if you just go to our website, livediseasefree.com, and look at our posts, our blog posts every week. We have amazing blog posts every week. So last week, the nice thing about that is you can go to Rumble and watch it, but if you go to our website and look at the blog, you can either read or you can watch the video. And I finished it off there to make sure that you understand. So energy testing is using the idea of biophysics. So every living organism has an energy field around them. And when we have stressors in our body, whether it's toxins or parasites, then we can have a decrease in our energy field. When you bring the correct remedy into the energy field, your energy will be restored, more balanced, you'll be strengthened. And so they can measure this either with some type of muscle testing or with machines. So whether it's a chiropractor that does applied kinesiology, or if it's a naturopathic physician that does some kind of muscle testing like ART, which is autonomic response testing, which was created by Dr. Klinghardt. And then sometimes they will also use different machines like an AMA machine or a Vega machine or an EAV machine that can pick up changes. So because we can't figure out which parasites we have, our tests are very poor. So you can have the stool test done, you can do the blood work, you can try those things, but chances are you're going to get a false negative. And if you are energy tested, then instead of trying to figure out which parasites you have, you're looking to see what treatments test the best for me. So if you have treatments like myself that treat roundworms and tapeworms or flukes, then you may have one or three of them. And so the way that we diagnose or the way that we figure out our game plan is we look at our health history. We look at the health history of our parents. We look at our symptoms because as I showed you today, there are some very specific symptoms. Like if your blood work shows that you have had anemia a lot or low ferritin, or maybe your red blood cells are decreased in numbers or they are larger than normal. All of these things will really help. And vitamin B12 deficiency, all of these things help to kind of confirm with what the energy testing. So again, then our diagnosis is also very helpful because we kind of are starting to see different types of parasites present in different types of diseases. On a whole, it's not 100% yet, but we're seeing that, again, it's not going to be one parasite that causes a disease. Think of it more like dysbiosis. You're out of balance. You have a few out of balance. You have to restore balance to those fews, and you have to figure out which ones they are. So energy testing will help you to find which treatments are testing the best for you. You can energy test herbs. You can test your supplements, your nutritional supplements. You can energy test different types of parasite treatments, the commonly prescribed parasite treatments. And so we will test for pharmaceuticals that treat worms and protists and fungi and the bacteria. We kind of find that that seems to work well enough just with the herbs. We don't really love antibiotics. If you have to use an antibiotic, if you've got a terrible acute bladder infection, please deal with it properly with antibiotics. But for treating these chronic pathogenic parasitic bacterial infections, we find that that's the herbs seem to be. And that oxidizing agent, which I almost said the name, but it's an oxidizing agent, and it really is, we can take it orally once we're ready, and that'll treat a lot of the bacteria and bigger parasites in our blood, and we can use it for enemas, and it is used in conjunction with the parasite drugs and the different types of antimicrobial herbs. Okay, one more question here. How long do you think anyone should be fighting parasites? Well, David, it's really, you treat the parasites until you're symptom free and then go a couple of months extra, because I heard today that the tapeworms, those proglotted sections, or I don't know if it's just like one section, maybe, I don't know. All I know is that they said the tapeworms can produce 1,000,000 eggs in a day, up to 1,000,000 eggs in a day. We know that roundworms can produce up to 200,000 eggs in a day. So you're just doing one or two treatment cycles, especially if you've had disease for a while, is not going to be enough. But if somebody's been sick for just a few months or just a few years, let's say with MS, for example, but they're still fairly high function, they're suffering for sure, but they're still able to walk. Maybe they can't work, but they're still able to walk and they're not extremely disabled. It might take 6 treatment cycles. If somebody has been disabled for many, many years, it might take a year to a year and a half of cycling through. But the key is to do it long enough and to use a strong enough dose. So that's why you have to work with someone. And if you're just new to all of this and you're like, what, Pam, parasites are causing my problem? Tapeworms? Seriously? Then watch our videos on YouTube, Facebook, Rumble. On Rumble, you'll find more of the things I can't really talk about here. And then start to learn about the different parasites, start to change your diet, learn about the Live Disease-Free diet. And then once you start to feel better and you really believe that this is what your problem is, and if you don't have somebody to help you, make sure to reach out to us. We have the Live Disease-Free plan. We will help you at whatever support you need. Watch my masterclass training. And otherwise, please share this video. Please help us to get the word out. And like and subscribe. And I will see you next week. Take care and bye-bye for now.